Hello everyone. Today's presentation is a presentation that I originally gave to the Maudsley NHS Trust a couple of months ago, and it's about the effectiveness of virtual assessment and care reviews for autistic people. So we'll just do a bit of screen sharing and then we'll begin. Okay, so it's effective virtual assessments and care reviews for autistic people at personal perspective. I'm myself, David Chris, from Wired for Autism. So learn about autism from the inside out from the only fully independent, actually autistic speaker in training in Northamptonshire. Apologise if some of this comes across as rather amateurish. I'm still fairly new to YouTube, just bear with me on that. So there's me then and now. It's me about 18 months old, and there's me now at the tender age of 56. The reason why I put this up is when I talk about autism, because I was late diagnosed and I wasn't diagnosed until I was 42, mainly because the years that I was at school, Asperger's syndrome hadn't been formally recognised as a label, let alone a diagnosis, which is why I came to the autism field late in life, although my children did present symptoms of autism from a very young age, from when I was in my mid-30s. So, and again, but like all autistic people, I do have some difficulties at times accessing healthcare and describing some of my symptoms, and can sometimes feel uncomfortable around a doctor. I'm okay in a hospital setting because I did nursing for a few years, and that's like a second home to me. But for other reasons I won't go into today, I still sometimes feel uncomfortable around the GP, mainly because we did have a little bit of a fight with healthcare professionals to get our children diagnosed, and there's an element of is anything I say going to be used against me or whatever. I know it's silly, but those anxieties still remain. So the aims of this presentation today are to identify the barriers to accessing care by autistic adults, and then the main crux to consider the effectiveness of virtual assessment and care reviews for autistic people. So a little bit of background here. Autistic people generally experience significantly poorer physical and mental health. Some of that is because we have difficulty describing our symptoms effectively. We may describe a pain in one part of the body and the pain is actually in another part because of sensory issues. And obviously with mental health, it can be very, very difficult sometimes to describe how you're feeling. So if you can't really describe it to yourself, describing that to a healthcare professional can be extremely difficult. And also autistic people have a reduced life expectancy. When I found this out a few years ago, I was shocked to find that the average life expectancy in the UK of an autistic adult is 53. Now I'm already 3 years above that, so it's quite scary. So it's squeaky bum time for me. And so the situation, the reason for this, both due to mental health and physical health, because of our heightened anxiety, because of our lack of friendships generally, and a strong social network. A lot of autistic people, and myself included, have a history of lots and lots of anxiety, and that can present a lot of mental health issues, and unfortunately a higher than average risk of suicide, even compared to people with diagnosed mental illness. And also, all those years of stress and anxiety can lead to build up in the body, causing high blood pressure, diabetes and heart disease and lots of other issues that which all impact on our physical health and reduce our life expectancy. And autistic people, again, may find it difficult to self-report health concerns. If you have problems in self-reporting your health concerns, thinking, oh, am I going to be believed? Because not everybody even believes, even if you got an autism diagnosis, people might not always accept that. And then when you find difficulty explaining your symptoms, that can cause issues too. And also autistic people may have difficulty booking appointments. More on that a bit later, but we've all heard the your call is really important to you. Well, if that important, why don't you actually pick up the phone? But we'll go into that in a bit more detail as we go along. So Some of this stems from a recent study that concluded that reduction of healthcare inequality for autistic people requires that healthcare providers understand autistic perspectives and communication needs, and adjustments for autism-specific needs are as necessary as ramps for wheelchair providers. That's in a study called Barriers to Healthcare for Autistic Adults, Consequences and Policy Implications by Doherty, Nielsen, O'Sullivan and others in 2020. That particular study consists of an online survey of 507 autistic adults, 196 parents of autistic children, and 157 control subjects. Of those autistic adults surveyed for the study, 79% reported difficulty visiting the GP, 72.2% reported difficulty deciding what symptoms warrant a GP visit, 61.9% expressed difficulty making appointments by telephone, 55.8% felt that they were not being understood, 53.1% had difficulty communicating with the doctor, 50.5% felt uncomfortable in the waiting room environment. Most surveyed preferred booking appointments online or via text rather than speaking on the telephone. More about that in a little while. Most preferred to email in advance. The reason, an email in advance from the professional, what the reason is for the consultation, and they generally preferred a first or last clinic appointment and a quiet place to wait. For autism-specific need for specific approaches to healthcare practices. I've mentioned before the barriers to attending appointments amongst autistic individuals, but in order to improve access to healthcare provision, professionals within this field need to receive mandatory training in autism to better appreciate and value neurodiversity. Last year, I was privileged to be a co-facilitator of an expert by experience in the Oliver McGowan mandatory training trial in autism and learning disabilities. And earlier this year, I was involved in the train the trainer for staff working in mental health units. Again, as an expert by experience. Both of these were trials for Health England that were conducted by the National Autistic Society and others. Both of these training offer a brief introduction to autism, outline best practice, and look at the consequences for autistic individuals where their healthcare needs are not fully identified. So, in short, what is autism? It's a lifelong neurodevelopmental condition that affects how people communicate, relate to other people, and how they experience the world around them. Now, a lot of definition for autism will say it's a neurodevelopmental disability. I would question that, in that not everyone that's autistic has a learning disability, some don't, and not everyone feels necessarily disabled by their autism. Sometimes the disability comes from outside, how people perceive us rather than a disability inherent within ourselves. So approximately 700,000 to 1 million autistic individuals in the UK. The reason for this discrepancy is that there are possibly 300,000 people that are either waiting to be diagnosed, do not, for whatever reason, want to be assessed or diagnosed, or maybe the person that you know that's presenting lots and lots of traits of autism but hasn't gone for an assessment, or they have another comorbid condition which is masking their autism presentation. What's called I forgot the word now. One of the problems with autism, sometimes you do occasionally forget words. Diagnostic overshadowing, that's what I was trying to think of. So many of us have comorbidities, in other words, another condition as well as autism. These could include epilepsy, diabetes, joint hypermobility, hypertension, obesity, and mental health problems, particularly anxiety-related conditions. Not surprising, if you suffer from low self-esteem, you have problems developing relationships, problems with friendships, from achieving your potential in life, whether it's education or employment, etc., because of the social difficulties that or differences that you present as an autistic person, or that you see from other people's perception of you as an autistic person, then it's not surprising you have lots of mental health problems. So, and also autistic people, in order to be diagnosed, have to have some sort of differences in expressive or receptive communication, executive functioning and planning, and sensory sensitivities, which cause many of us to have significant barriers in accessing healthcare. What I mean by expressive and receptive communication: expressive is what we express either verbally or non-verbally. Receptive is how we receive communication from others. For example, some autistic people, I'll use my daughter as an example, although she's by no means not unique in this, have difficulties picking out the important words or phrases within a conversation. For example, she will she's been taught to pick out the wow words, in a sense, the important words that are required, that are really important, because neurotypicals people particularly like nothing better than to confuse you with jargon or use lots of superfluous language that is not needed in the conversation. And that can be a problem when you're accessing healthcare. Doctor may use over medicalized language and jargon, and before you know it, you're totally confused as to what's wrong with you. Even common medical conditions such as hypotension and hypertension, because the difference is very, very slight from an auditory point of view, but they're very, very different conditions. One's high blood pressure, hyper low blood pressure, but can easily be misinterpreted because they sound quite alike, but they are at opposite ends of the medical conditions. And obviously, a lot of autistic people, as we mentioned already, have negative experiences of accessing healthcare, and this may cause significant barriers. Unfortunately, some people even have a problem because of their autism and being believed. For example, my daughter's experiencing this, and I know that there's several people that are autistic, including myself, have also experienced, well, you don't look like you're autistic, or they won't accept your autism diagnosis if you fought so long and hard for, because you don't fit what the professional feels is an autism presentation. Well, everybody that's autistic is unique, so therefore, and we all have unique experiences, and sometimes people don't appreciate that, and they'll say things like, oh, you can't be autistic because you can speak, you can't be autistic because you can articulate language, you can't be autistic because you've got friends, etc., which are all this impacts on your ability or willingness to go for health and health professionals. Another research study example is here by Unegwe, Buckley, Crane, Kenny, Remington, and Pellicano in 2017, which was a study made by the National Autistic Society and Health Education England and others, and they found that almost 40% of GPs reported no formal autism training and have limited confidence in managing autistic patients. This is one of the main reasons why the Oliver McGowan mandatory training is so important. The fact that all health and social care staff will receive mandatory training in autism. A further report by Nicolaides and others in August 2020 also concluded that only 25% of primary healthcare providers reported high confidence in communicating with autistic adult patients or identifying and making necessary accommodations. So what are these difficulties of accessing healthcare? Well, barriers to accessing healthcare, the first one, as already mentioned, communication issues. The difficulty you have in being understood because of your expressive and receptive communication in itself, and then you've got the difficulty in booking an appointment, not feeling understood, difficulty communicating with the doctor or reception staff, avoiding using the telephone, voicemail, or face-to-face verbal communication. Lots of different issues. Secondly, lack of predictability control. Long waiting times, which have been horrendous pre-COVID and post-COVID, beyond horrendous now. So the problem with booking and handling and attending appointments can be very difficult. Not sure exactly which doctor you're going to see. You may have a letter for a hospital appointment that will say you're down to see Dr. Smith's clinic, for example, and you're expecting possibly to see Dr. Smith, and it could well be it's not Dr. Smith, it's one of his team. It may not even be a doctor that you see, for example, particularly if it's like an epilepsy appointment, when you may be referred to the specialist epilepsy nurse instead. And then you're not sure what's going to happen during that consultation and how long it's going to last. So then you have problems as well as the appointment itself, thinking problems with parking. Am I going to have enough time to catch the right person? There's lots and lots of issues that all of us are scared about, but if you're autistic, those worries are greatly magnified. And then you've got problems with sensory processing, the waiting room environment, crowded, it could be noise, you have strong lighting, smells, etc. Sometimes, particularly child facilities, can be too child friendly for lots of people that are autistic. There could be things like lots of Mickey Mouse or whatever the current vogue is on the walls, lots and lots of posters, etc., to make it look as child friendly as possible. But for an autistic child, that can be too much information coming in. And I know my daughter preferred a much more the colder and clinical setting, the less stress she became, because it was less in her face, shall we say. Then they've got the judgment and negative attitudes from healthcare professionals. For example, in the Doherty, Nielsen, and O'Sullivan did a study in 2020 and found that a staggering 96.6%, now nearly 100% of autistic individuals reported anxiety accessing healthcare, worrying about, like I said earlier, not being taken seriously, wasting everyone's time, or being considered a hypochondriac. In addition, many autistic individuals risk or fear being accused of FII, false or induced illnesses. Making out that their condition or their children's medical conditions are worse than they actually are, and the child is more disabled than that in reality. And then you've got, do I disclose my autism diagnosis to a doctor or nurse? If I do, will they accept the diagnosis? Most doctors, as we already established, are not experts in autism. So, and also they may not be aware of an individual's autism diagnosis, and a patient may have chosen not to disclose their diagnosis, or, and I've already mentioned, more damaging, doctors may not accept the autism diagnosis. The old, well, you don't look or appear autistic to me. We've all heard that. Every autistic person I've ever come across has heard that at least once in their lifetime. And sadly, very often from healthcare professionals too. Then you've got difficulties with planning and organising. Many autistic individuals have difficulties organising or planning their healthcare, such as making an appointment in advance, prioritising their health issues. The doctor may only deal with one issue at a time, particularly GPs. And autistic individuals are more likely to miss a medical appointment or attend the wrong day or time because of memory issues, difficulty in processing information, maybe not writing it down, etc. Then you've got unmet support needs. Autistic individuals are more likely than neurotypical individuals to need a chaperone, relative, friend, or advocate, or support staff, or anyone to intercede or share information on their behalf. And one of the biggest problems that a lot of people have, and obviously autistic people possibly more so, is you have a meeting with the doctor, you leave the doctor's waiting room, and just before you go, the doctor says, "Have you got anything else? Got any questions?" And you go, "No," because you just want to get out of that room as soon as possible, or you've been blasted with so much information, you feel like your brain's about to explode. And then what happens? The moment you're out of that room, you think, "Oh, I should have mentioned this." And we all do it. And of course, autistic people do this, much more likely to do this. And they're more likely to get very anxious about the fact that that wasn't done. And then you've got the issues with booking and facilitating the appointment. Again, I mentioned already, emailing a doctor in advance can help to make sure the doctor's aware of your specific issues regarding sensory needs, for example. And you may say, well, I don't want to be near a window because, or want to be, don't be too near the air conditioning because the sound certainly is. All these sort of things can help. And again, if possible, the opportunity to wait in a quiet area or outside until the doctor's ready to commence appointment. Booking at a quieter time of day, or opportunities to wear or be provided with sensory aids such as ear defenders, headphones, sunglasses, etc. So it is clear then from research, anecdotal evidence and first-hand accounts that many autistic individuals experience difficulties in booking, attending and fully participating in healthcare assessments and reviews. Some of these difficulties can be exacerbated by anxieties around face-to-face consultations due to their communication and sensory issues. With the advent of new technology, from easier access to telecommunications through to virtual consultation via the internet, there are alternatives being developed to traditional approaches in healthcare. The impact of the COVID-19 pandemic has accelerated this growth of digital and remote consultations, assessments and reviews. Much of this has obviously been borne out of necessity, as the majority of face-to-face consultations were suspended due to lockdowns and enforced social distances to reduce the spread of infection and reduce footfall to healthcare providers. It is highly likely that remote consultation will continue to be widely adopted post-pandemic as convenient and low-cost alternatives to traditional consultations. For the remainder of this presentation, I will concentrate on the core topic for today's meeting: the effectiveness of virtual assessment and care reviews. I'm not an academic in a literal sense, but I have experienced firsthand the pros and cons of this approach to healthcare consultations and monitoring. The parent of a 23-year-old autistic daughter who also has significant physical, mental health and disability needs. So, what are these alternatives to face-to-face consultations? The two main tools for healthcare professionals are telephone consultations and video calls. Telephone consultations have been used in general practice for a number of years, but a relatively new phenomenon to use in general medicine or mental health services. I've already mentioned the economic inconvenience of this approach, but studies such as those conducted by Hewitt, Gaffaranga and McKinstry in 2010 demonstrated that patients tend to disclose fewer medical issues over the telephone than during face-to-face consultations. Video calls, whilst more economical and convenient for professionals, rely on a high-quality internet connection, the reliability of which can vary widely between both households and healthcare providers. Plus, professionals have to rely on basic IT literacy for create effective client-patient compliance and engagement. If you factor autism into this equation, a number of additional variables come into play. As mentioned earlier, autistics have differences in social communication, social interaction, and sensory perception. Some of these differences may be either exacerbated or reduced when autistic individuals have access to virtual assessments. It's an old adage, and one that I've mentioned already, that when you've met one autistic person, you have met one autistic individual. Everyone who is autistic will present differently. And in addition, every autistic individual's ability to communicate or interact at any given time may be affected by sensory or telephone, their environmental factors. So let's look at telephone consultations. In 2021, Philippa L. Howard and Felicity Sedgwick from the University of Bristol produced an article entitled "Anything But the Phone," looking at preferred communication preferences amongst autistic individuals. They concluded that whenever contacting unknown people, organisations or health professionals, the emails were preferred rather than face-to-face or especially phone calls. Further evidence from a number of other sources and studies have suggested that many autistic people prefer written methods of contact, such as reports, letters, especially text and emails. But why is this? Well, my daughter introduced me to the concept of wow words in a sentence, as mentioned earlier. This means, in essence, splitting down a sentence or phrase to its component parts and focuses on the important words. While some autistic individuals are non-verbal or have significant impairment in communication, most of us have difficulties more in the social aspects of communication, such as tone, pitch, context, comprehension, etc. And these difficulties of communication may mean that they find difficulty in focusing on the precise message as they seek to decipher the multiple filler words in a sentence. And by the time that sentence has been stripped to its bare essentials, it is likely that the second and third sentences may be already in full swing. The result can be a confusing mixture of words and phrases which may easily be misconstrued or taken completely out of context. This lack of processing control, thinking time, coupled with possible sensory issues such as noises online or from the home or healthcare environment, makes effective communication very difficult. Conversely, some individuals, including autistic individuals, especially those under stress or anxious, may have the tendency to interrupt, talk over, or, and I'm particularly guilty of this, go off on a tangent. Consequently, it can be very difficult for healthcare professionals to find out the real issues an autistic individual has amongst a cacophony of information, leading to the health professional having to now be the individual doing the decoding themselves. Sometimes the effects of this misunderstanding can be very distressing for the autistic individual. Imagine an autistic patient being told over the phone that a biopsy is non-cancerous, but not hearing or receiving that important little word, no. Truly devastating. Another difficulty in this area is that many autistic find it very difficult to talk to a stranger or professional on the phone. My son, for example, 25 years old, degree in psychology, qualified teacher, and yet, despite his intellect, due to his autism presentation, he finds it very difficult at times to talk to parents, doctors, or even order a taxi on the telephone. With practice, it becomes easier for him to order a taxi because there is, by definition, a rehearsed script. Taxi at X time to go to Y for Z time, etc. However, most professional telephone calls are not scripted and rely on creating and reacting to a fluid, changing dialogue whose content and direction is variable and of uncertain duration. Anyone who has tried booking a GP or hospital appointment over the telephone, particularly during these COVID days, knows how stressful and time-consuming that can be. First, the potential long delay to get past the engaged tone to speak to someone or leave a message, then having to endure the worst rendition of Greensleeves since Tudor times when put on hold, and then the constant reassurances that your call is important to us. So important, I was actually picking up the phone. Once you throw autism into the mix, with probable sensory and processing issues, it's little surprise that the majority of autistic people become very anxious and reluctant to use telephone as a form of communication. Further, the uncertainty of callback timings can also cause extreme anxiety amongst autistic individuals. Generic messages like morning or afternoon without being specific can be very stressful. It can feel extremely debilitating being in a form of limbo, wait for the phone to ring. This generic approach does not support autistic individuals in any way. They may not have sufficient time to prepare for the call or engage in the stress relief and anxiety whilst waiting. I've already mentioned processing time for autistic individuals. This can be exacerbated by the uncertainty of when to expect a health call. Sensory issues can also come into play. If the time of the call is unexpected, the autistic individual may be shopping or at work, plus possible privacy and confidentiality concerns. One aspect of autism largely overlooked when considering sensory differences is the sense of interoception, how the individual perceives physiological feedback from the body. It can be very difficult for many autistic individuals to describe concepts like pain, how they are feeling, or even experience or show pain in a manner a doctor can fully understand. Over a telephone, it can be not possible. My daughter, for example, may describe she has a headache and a tummy, which might be better to describe to the doctor visually by pointing to the exact point of pain in a visual or face-to-face consultation rather than on telephone. So before going on to discuss video calls, let's consider some strategies that might make telephone consultations more autism friendly. Number one, facilitating access to telephone consultations. Patients' notes should be flagged with autism diagnosis and specific strategies personal to the individual concerned. By so doing, The clerical and administrative teams, as well as clinicians, are in a better position to offer best care for that individual. Allow autistic patients to request the most accessible type of appointment for their individual needs, again to reduce the barriers to access. Mentioned earlier, some individuals may not cope well with telephone calls, so alternatives may need to be offered. Offer online booking for those who may be unable to cope with booking appointments by telephone. Again, offer longer or double appointments. Many autistic individuals may need longer appointment times due to their specific communication needs. If it takes them longer than a neurotypical person, for example, to process information or to express themselves, then a short 5-10 minute consultation with the GP may not be sufficient. Again, I've already mentioned this, but offer clearly defined appointment times, because this allows sufficient preparation time and ensures optimal environment for telephone consultations. While on this subject, sometimes it's inevitable that appointments may be out of sync because of a previous appointment overrunning or the doctor's running late, for example. There's good strategy, particularly for an autistic person, for the receptionist to explain the doctor's running half an hour late, because then at least the individual knows that they're going to have a longer wait than they expected. And may give them a chance to say, well, can I book myself and then go and get have a coffee and come back later? You'd be surprised, some people may allow that, and that again could be useful to allow that person to de-stress while they're waiting. And also it means that the receptionist is less likely to get abuse from the autistic or non-autistic patient who's having to wait longer than they were expected. So what can you do during the consultation? I've already mentioned this and I'll keep repeating it because it's so important. Allow extra processing times. Due to their nature of autism, many autistic individuals may require extra time to process information. Remember, wow words. Avoid rephrasing questions unless directed by patient. Rephrasing may introduce possible confusion to autistic patient, as another set of information needs to be deciphered. Using clear and unambiguous language. Always use language that is appropriate to that individual. Some autistics are well read and may be almost encyclopedic in their knowledge, but others may not be fully capable of interpreting anecdotal language. So again, we're using words like stroke, CVA, decide which one you're going to use. Don't alternate between the two, for example. Adding extra checks, provide reflective listening. It's always a good practice to employ reflective listening approaches as standard in all forms of healthcare provision. This enables the professional to evaluate the patient's understanding and ensure cooperation and compliance. This is particularly important over the telephone, where environmental and sensory consideration can be barriers to effective listening, especially when coupled with the heightened anxieties that many autistic individuals experience at any given time. For example, I've used today as a perfect example right now. One of our neighbours is having half their garden dug up. So lots of banging and crashing going on, diggers going. So you may occasionally hear one of my dogs barking in the background whilst I'm doing this presentation. Clearly not surprising, but if I was on the telephone, that could affect how I process all the information from that telephone call. So again, I've mentioned this before, it's very, very important. Avoid too much medical jargon or complicated phrasing. And remember again, some medical terminology can be very, very similar sounding. Hypo and hypo, for example, that's already mentioned. Medical abbreviations, especially over the telephone, where individual letters can easily be misheard or misinterpreted. Again, hypo, or complicated or convoluted medical phrasing can be considerable barriers to effective dialogue with autistic individuals. So what can be done following a telephone appointment? First instance, consider text messaging to summarize the information and outline immediate actions. It's no good verbally giving some people, some autistic people, the information that what's happened today, what they've got to do when they get home, for example, because that could be very, very confusing for them. So sometimes put some of that down into text. Like see you in a week. Well, put it down into text. If you're still not things haven't cleared up in 5 days, make another appointment. That's in writing. It's much easier. If you go away and think, well, did that say 5 days? Did it say 3 days? Did it say 7 days? It's much less in the air. And again, post-consultation letter or email to patients, because that provides, as I've just mentioned, more detailed information. It reinforces the immediate actions that the doctor and the patient, or nurse and the patient, have to undertake, and outline the next steps and follow-up appointment details. Collectively, both of these actions can help ensure effective communication of key outcomes. Now, video consultations. In his report, The Impact of Austerity on Mental Health Service Provision, a UK Perspective in 2018, I. Cummins draws attention to the fact that mental health care has been under considerable strain for over a decade. Recently, this pressure has increased exponentially during the COVID-19 lockdown restrictions, with Bloom, Dorsey and Oaken, as shown here, and others arguing that this crisis has been the catalyst for telemedicine. Over recent years, particularly during the COVID-19 pandemic, video calls have been an increasingly routine part of everyday life. For many patients, however, video calls with general practice on mental health care remain relatively novel, and for some, a disconcerting experience, particularly amongst older age groups. Now remember, many people such as myself may have been diagnosed as autistic later in life, particularly those at the higher end of the spectrum, the Asperger, high functional autism people. So so that group particularly may find video consultations to be harder to access because they've not grown up with technology and we're having to learn it as we go along. Whilst video may be equally challenging for some autistic adults to use a telephone, the vast majority of autistic individuals, according to surveys, prefer to utilize video over telephone consultations. And this is supported by most recent research in this field. It's also useful to note the clear dichotomy of the effectiveness of video consultation between young and old patients and those autistic individuals who possess a learning disability and those who are not intellectually impaired. From the limited research in this area so far, it is therefore essential to identify those attributes that are more suitable or less suitable to this new approach to healthcare assessment and review. These can include, is a person IT literate and do they have suitable equipment? Considerations must include older people who may struggle, as already mentioned in this regard, patients with computer, tablet or smartphone that cannot attend the clinic in person for whatever reason, anxious, avoidant, dissociative patients, for example, that have PTSD, agoraphobia, claustrophobia, OCD, etc., who may have concern in that particular incident or cross-contamination, COVID, etc. Health-related anxiety, socially anxious, shielding. And also we're looking at suitability for video consultations, express preference. Again, staff must not make assumptions that patients preferring face-to-face interventions to be accommodated on a case-by-case basis. Always be led by patients. Some patients prefer video to face-to-face. Teenagers and young adults, particularly older teenagers, students and young adults, have been brought up with this technology and it may be easily accessible to them. And they're quite happy conversing through a screen. Others not so. Then living in isolated or rural settings where there's without good access to transport. However, conversely, there may be poor internet connection. So again, you have to weigh the pros and cons of this. Then there's, of course, those that have a high risk to self or others, or those people who are shielded, for example, or those that may have a history or risk of violence, in which case it may deem a better idea to do video calling. Autistic spectrum disorders with or without a learning disability. In a study by Painter, Turner and Proctor from last year, they argued that many autistic users prefer to utilize video for assessment over leaving home to attend face-to-face appointments in the clinical workplace. However, autistic individuals with an associated learning disability were often found to struggle without support to use the software. Indeed, some requested not to have online consultations, preferring to wait until face-to-face is permitted. And others found it extremely difficult to function well on online consultations. So, excuse me. So what can we do to help patients to get the most out of virtual appointments? Again, offer informed choice to assist patients to decide what is best for them at a particular time, phone or video. Important that staff are flexible and listen and respect the patient's individual wishes. Some autistic people, although it may go against what I said earlier, prefer telephone appointments because it's easier to concentrate when having to look at someone's face. But others prefer video calling, especially if there is a chat function or captions, so that there is written information to support and enhance communication, and they can type rather than verbalize their concerns. And it may be that the patient themselves doesn't necessarily, if they're uncomfortable having their camera on, doesn't necessarily need to have their camera on throughout the consultation. They can communicate via chat. It's also very important for people that are non-verbal or selectively mute, or become selectively mute due to stressful situations in which they can communicate through alternative means. Encourage the patient to make a list before the call. This may help the patient to state their main concerns. These may become muddled or forgotten during the conversation. Support the patient to find a quiet place and appropriate time for an appointment. And again, support the patient to share their main concerns. Ask the patient, are there any special considerations that make the communication more effective, such as, would it help if I spoke at a slower pace? Again, try to avoid too many filler words or jargon. Provide opportunities for reflection and feedback to confirm understanding. I cannot emphasize enough the importance of reflection and feedback to confirm understanding. And provide sufficient time for a patient to make a record of the conversation. Support them to take notes if required, or with permission, maybe even do an audio recording of the consultation. It's easy to forget information or misinterpret information when a patient is feeling anxious or upset. And always conclude with a summary or an action plan. So at the end of the appointment, highlight the main points of the conversation, encourage patients to reflect these back, provide opportunities for asking questions or airing concerns. So, what are the implications for autistic patients after all this? Well, earlier, I highlighted particular barriers to accessing effective healthcare provision for autistic adults. As I've already mentioned, I've been privileged to be involved in the Oliver McGowan mandatory training trial, and more recently, the co-facilitating the train the trainer in autism for staff working in inpatient mental health settings. As already mentioned, these initiatives will enable greater acceptance and recognition of autism by healthcare professionals. We need to move away from this autism awareness to autism acceptance, not simply being aware of autism, but knowing and understanding what makes an autistic person tick and how we can best support them. Bear in mind, many autistic individuals that come into your services may also be undiagnosed or choosing not to be assessed for a diagnosis, or there may be diagnostic overshadowing and other things going on. Remember, in itself, autism is not a mental health disorder. I cannot stress this enough. It's a neurodevelopmental difference, and autistic individuals like myself are wired differently. In effect, we have a different processing system to neurotypical individuals, in other words, those people that are not autistic. So before concluding this presentation, I ask you to reflect back upon the specific areas of difference of autistic individuals and how best to support them, whether in a virtual setting or face-to-face. Communication, sensory processing, predictability control. Considering these actions already mentioned, communication, allow text-based e-consulting before consultation, provide written instructions or follow-up advice after consultation, use clear, unambiguous language, offer online appointments, allow time to process, consider longer appointment slots, and provide written information on procedures, and consider enhanced support for screening. Sensory processing. Conduct a sensory audit of waiting and consulting spaces. Think of those areas in the waiting room that are more noisy than others, and consider lighting and other aspects. Permit patients to have their camera off if they desire, like I mentioned earlier, during video consultations, obviously depending upon circumstances. And many autistic people, you probably even notice it myself, find it difficulty sometimes maintaining eye contact, and so if you don't have to look at somebody's face, it can be easier then to keep your train of thought, which is one of the reasons why I'm drifting away. Sometimes glance at the notes I've got here, and other times because it's quite anxious. I'm quite anxious staring at, spend a lot of time talking to a camera. And again, ensure the person has appropriate point in time. Whenever possible, I know it's very, very difficult now. Consider having an autistic person beginning or end of a consultation, beginning preferably for many people, because that way, if they're the first person in, even if the clinic's running late, it's less of an issue than if it's running late and then every other appointment's running late, and before you know it, your appointment's an hour late. And again, predictability and control. Whenever possible, prefer to see a regular doctor or practitioner. I know how extremely difficult it can be, particularly GPs, but whenever possible, instruct on what to expect at appointments, tell the patient what to expect and what you're doing during examinations, and signpost the patient to clear directed resources. For example, autism.org and obviously the NHS website. And give advice on expected waiting times. We all know how busy the NHS is, and you go to A&E particularly, and you can be in there what seems like an eternity to be seen for obvious reasons. It doesn't do any harm to think that person's autistic. Give them regular updates, even if it's just as you're passing, oh, so we haven't gotten you, but the doctor's running a bit late, or it's going to be another hour. Let's have a coffee. We know you're already booked in, etc. All those things can help quite a lot. So, to conclude, against the backdrop of COVID-19, visual consultations have removed many of the barriers for autistic people requiring access to mental health services. However, uptake can be variable, with some individuals being reluctant to embrace these new approaches. Sometimes precise reasons can be hard to pin down. Excuse me. Of the limited research studies in the UK thus far, statistical and anecdotal evidence suggests that services should move away from an reliance on phone calls for communication. Instead of dependence on telephone, written options such as email, live messages or online chat or captions during video calling may make virtual assessment and reviews more accessible. Further research should investigate the impact of COVID-19 on an individual's communication preferences, particularly those who are autistic or have mental health issues. Clearly, video calling will become more commonly used post-COVID and has been shown to present both benefits and challenges to staff and patients alike. Significant progress towards eliminating healthcare inequalities for autistic people can only be achieved by understanding the healthcare experiences and access barriers for vulnerable patient groups. There's some references there, and again, if you need any more information on where to find these references, just drop me a comment or send me an email, and I will reflect these too. So to conclude, like I hope most people that are autistic, I am proud to be autistic, but it doesn't mean it's always easy, and at times it can be very, very difficult, particularly with accessing healthcare provision. So thank you everyone for listening. This is me, David Crisp, independent autism speaker and trainer. If you like what I'm saying today, then follow me on social media. There's my website detail there, whiteforautism.co.uk, and please subscribe to my brand new YouTube channel, which this video will be one of those on there, called Autistic Conversations. Over the next few months, I'm going to do some one-on-one conversations with autistic people, professionals in the field of autism, to share our experiences with you. So watch this space. Thank you everyone for watching this video, and I hope to see you all again soon. Thank you.